The first presentation is from Professor Giancarlo Comi. He's going to tell us about the Multi-Act project. Professor Giancarlo Comi is from the European Charcot Foundation in Milan, Italy. The Multi-Act project is focused on enabling multi-stakeholder, mission-oriented research and innovation. And I'm very curious, Professor Comi, how this can lead to personalized care. We're going to hear all about it. The floor is yours.
Okay, so first of all, I would like to introduce myself. I'm the president of the European Charcot Foundation. The European Charcot Foundation is a no-profit organization, active since more than 25 years. With the ambition to promote, not only in Europe now, I have to say, because the foundation is now active everywhere, to promote research and educational activities in the area of multiple sclerosis. So for this reason, we got in contact with Multi-Act, and this is the reason why I'm here today, just to try to introduce the action that is ongoing in collaboration with Multi-Act. So in a time of challenges or that call for mission-oriented research, such as those of COVID-19 pandemic, for example, the future of healthcare sustainability requires, no doubt, a combination of different forces. So multi-stakeholders and multidisciplinary managerial models of cooperation are fundamental. They may guarantee a long-term return of investment for all the stakeholders, and in different contexts, not only the economic one. Of course, always in medicine, the patient is the center of all this initiative, and the major return, if I can say, has to be for the patient, but it doesn't really exclude, and it also requires that all the other aspects are satisfied. So I think that the area of neuroscience, that is the one I am directly involved, is of course a very important area. Neurological diseases are the third cause of death, and they are really one of the major causes of disability. 179 million Europeans have some level of neurological disorders, and the cost of this disorder is really extremely high. It has been estimated to be of the order of 800 billion euros. So at the end, if you look at these numbers, it means that in each family, one person has some problems with the central nervous system function. So I think then it is fundamental to have such a concerted action in the area of neurological disorders. So really is the major point. Here is really the area where it is more and more, I have to say, because in the more recent years, these multi-stakeholder initiatives are becoming quite diffuse, quite relevant, and this is in line with the mission of responsible research innovation, European Horizon 2020 program that encourage different stakeholders to work together during the whole research and innovation process, and to keep it aligned with the various needs and expectations of society. But again, I want to put really in front the patient role and the patient interest. So here is where Multi-Act has a role to play. MultiAct is a project that has been founded by the European Commission within the Responsible Research and Innovation Programme, represents a timely opportunity of an important reference for structuring a model of mission-oriented quality sustainability. And this is also another very important point to underline. Sustainability is really, of course, a requirement that is fundamental for any type of action, particularly in this area. So the mission-related dimension is one explicit driver for co-accountability approach developed by MultiAct project. MultiAct will be focused on brain disorders in general, and the first area of interest was focused on multiple sclerosis. The reason why multiple sclerosis was there was first because the promoter and coordinator of the MultiAct is operating in the area of multiple sclerosis, being the scientific director of the major Italian Association for Research in the area of multiple sclerosis, representing Patients Association. And second, because multiple sclerosis is the major cause of disability of neurological area in young persons. So it is a disease starting at the age of 20, 30 and lasting the entire life. So quite strong impact in terms of quality of life. And for this reason, it came really at the first level of interest. The project was started in 2018, in the May 2018, and has a 3-year duration. So we are just in the middle. It brings together some leading European society, patients organizations, research center, academic center, but also industry, pharma industry particularly, and technological organization, and of course, institutions, particularly governmental institutions. This consortium is a multidisciplinary network that integrates and coordinates various competencies in related area of the work that will be undertaken. As I said, the project is coordinated by the Italian MS Society Foundation, and this foundation is a member of the International Federation of Multiple Sclerosis. It's a boundary organization because it really aims to be really at the cross border of science and patients. That's another very important area that I want really to highlight, how the patient role is becoming more and more relevant. This is clearly one of the statements of the, for example, of the European Agency for Medicine. The voice of patients, of course, is fundamental on many different levels, but particularly when we focus on choice that are concerning treatment and management of the disease. So MultiAct provide a new collective research impact framework, which is translated into a new governance criteria, allowing for the effective cooperation of all the relevant stakeholders in the multi-stakeholder research initiatives, and transforming governance. The innovative guidelines for effective patients engagement across the health research and innovation pathway, a new co-accountability model for the assessment of research impact. Of course, accountability is another fundamental point. Any type of action need to be in some way evaluated and reported, and that's a fundamental step to guarantee that the action is followed by some result that can be measured. That has to be applied at all the levels. So starting from the mission of multi-stakeholder mesh initiatives, this model will be then applicable in defining the scope of health research and care in many different contexts. I mean, that's, for example, in the evaluating the impact of research plans and campaigns, or in new initiatives that aims to modify the level of assistance in different neurological disorders. Conventional methods related to the excellence dimension will be integrated with new measures related to the economic and financial dimension in order to estimate the efficiency of the intervention, and to the social dimension that then in some way relates to the achievement of mission success. So efficacy, one explicit driver of the multi-act co-accountability approach. That's one of the key points. The patient-reported dimension will be applied in a transversal modality throughout the dimension of the multi-act model. And here you see the 5 different dimensions that will really constitute the way we want to assess the value, the efficiency, and the quality, aiming to the excellence of different type of intervention. And of course, you see, we need to have a digital toolbox just to be able to support the research where this type of evaluation is applied. You can see here even better that the social dimension of the social impact of the action is a very relevant point. The way the intervention is able to produce in line with the mission, the quality of the impact, the efficiency of the modality of operate, and the central role of patient are really all in the same level of evaluation, aiming to the excellence as the key aspect. So then one of the first point that was clear, and I had really the very, let's say, positive role to be involved in the multi-act project, and at the same time to be involved in the presentation of the case study, the first case study, where multi-act tried to evaluate the possibility to succeed in this type of object, that is to have a new tool to examine and to evaluate any specification in the area of social and medical interventions. I said I was also in the very happy condition to be one of the promoters of the MS Care Unit. So the MS Care Unit is the case study, and the big advantage here is that MS Care Unit was a project born very recently, 1.5 years ago, in the European Charcot Foundation. The call for an action in the area of the quality of care in multiple sclerosis has been published in the major journal on this type of disease, that is the MS Journal. And in this paper, we really try to define why we need some intervention in the area of the quality of the assistance to patients with multiple sclerosis. The reason why this type of action was promoted by the European Charcot Foundation is really clearly defined by the fact that European Charcot Foundation is a site where we have the convergence of most of the stakeholders that can have an interest on the quality of the assistance. From one side, we have all the major European initiative in the area of MS. You see here listed many different areas. These are all initiatives that see different type, with different profile, with different composition, but they see as a main scope the improvement on the quality of the assistance to multiple sclerosis. For example, I want just to mention here a couple of these initiatives. One is PROMS, and the other one is MS Data Alliance, because these are two very important actions. One in the area of collection of a very large amount of data. Is the problem of the big data that now is also central in the 2020 program. From the other side, PROMS stay for patient-reported outcomes in multiple sclerosis. So again, is the heart of the action of the case study in multi-eye, because it is the tentative we have in mind to try to promote the quality of the voice of the patient. So we need to have a science with the patient input and of the patient input. So only in this way, the patient became really central to the action. And the other type of stakeholders that are involved here are, for example, the European MS platform. That is another expression of the activity of the combination of the different national MS societies, patient organizations, in order to promote link with, from one side, the national and supranational institutions involved in health, and from the other side, the academic center. EN is the European Academy of Neurology, so the major organization of neurologists in Europe. ECTIMS is the major association that focuses on multiple sclerosis. So, I mean, a quite large body of people working all together. And here you see a list of all the pharma companies that are also involved. All these are operating today under the umbrella of the European Charcot Foundation. And the concept of MS care unit is in some way the result of the convergence of all these different stakeholders in the idea that the quality of the assistance and the models to provide assistance to MS patients are really a fundamental aspect. I heard that we have only two of us present in this talk, so I can spend a bit of time, I think, in my talk just to try to better explain which is the action. So again, this is just to give you a bit of view about how we may really have a so important different contribution, and also again, it is now clearly understandable why Multi-Act has decided to use the MS care unit as the case study here. Let me say also that there is another advantage in this choice, that is that this is just a started initiative. So this allows us to operate in a co-creation approach, because from one side, the MS care unit initiatives require to have a way to evaluate the applicability of this concept. Of course, with the MS care unit, we pretend to guarantee that across Europe, all patients will receive the same quality of assistance. Is a very high ambition. We have a lot of different models of health organization in different European countries, but we thought that this could be a very important step, a great advancement in the modality of providing assistance to a so severe disease. But and the co-creation is really is a real possibility, because we are interested for multi-act, because we can represent an interesting case study with all these stakeholders already there. But from the other side, we have all the interest as European Charcot Foundation to have on board the multi-act, because it could be the best tool in our opinion, and then we will see if this is true or not, but this is what we think, in order to have a way to estimate the impact of this model that we propose in the health.
Professor Comi,
yes.
may I shortly interrupt you?
Of course.
I know you're, I see you're very enthusiastic, but I also know you have much more to tell.
But I will accelerate. Don't be worried.
Okay.
I will stay my time.
Can we do it in another 10 minutes and then switch to Rowan?
This is exactly what I plan to do.
That's great. Thank you very much.
Be confident in me. So then I think I already in some way explained which is our mission. That is quite, of course, high ambition. For this reason, we should really pay attention to the sustainability of the mission itself. Otherwise, it's just something that is part of the reality. Just very quickly to give you which is the concept here. The concept is that we should provide a quality of assistance at a very high level that is supported by the fact that there is a convergence of different disciplines in the production of the quality of the assistance. Here you see listed a very basic level of contribution that we might have, but if we want to go at the highest level, in our proposal, the MS care unit, there are two different levels. There is a basic MS care unit, and then there is the very high competent MS care unit, and they have to operate in a network, so that according to the complexity of the patient case, you may have just the first level or the second level is required. That's really the concept. So, so the idea, of course, is that we want to co-create, as I said, with the MS multi-act to refine the agenda. So it's try to find which are the priorities, how to fulfill the mission, and then trying to come up with a group of indicators that may really allow us to provide a way to estimate the type of impact of the evaluation. And this is the multi-act operative framework that may just give you, without, again, to go too much in details, but that may give you an idea about we would like to operate in this context. And here, the collective materiality analysis that aims to estimate the relevant aspect of the action of multi-stakeholders with the definition of indications and the collection of data concerning the type of intervention are all fundamental steps in the mission. This is the way the operation will be possible. So we have at the board, at the top, the European Charcot Foundation board. This is the model of the organization, how it works, and we have this multi-stakeholder initiative I listed, where we have the presence of all the different stakeholders. From the other side, you have the MS care unit with the governance of this type of action. MS care unit is working with the definition of strategic priorities in terms of structure, function, sustainability, and impact. And then from the other side, as I said, we have our tool, we have multi-act with all the aim to try to really bring the excellence with the concept of the validity and the relevance of the action. So a fundamental type of connection. How to try to reach such an ambitious plan? Well, here is where the materiality analysis play really a role, is the bridge. It makes the bridge workable between the mission and the outcome of multi-stakeholder initiative in the area of MS care unit. So throughout the materiality analysis, the master scorecard, that is the tool that evaluates the impact, allow the selection of impact indicator prioritized by MS care unit stakeholders and in line with the project mission and the agenda. And these are the 5 dimensions, again, that I showed will be used in order to define the value of the initiative itself. Different aspects have been evaluated for each of these type of sections. And as you see here, some have a larger body of analysis. For excellence, for example, 20 aspects have been defined as of fundamental role. For others, the number of parameters are a bit less, but in this combination of when we explore from different points of view the goodness of our action, we will come up with results that will be able to define the value of the initiative itself. All dimensions should be covered by a maximum number of indicators, that is 12. However, we had a quite flexible approach from this point of view. Of course, there's no way to go too much in detail here. I don't want, it's just to give a bit of global idea. But here you see, for example, the list of relevant aspects concerning quality of life. The cognitive function, for example, is considered extremely important. Of course, the locomotor ability, so the physical disability assessment, is also extremely important. Some aspects that are very important for patients, for example, fatigue is one of the very important dimensions that has to be examined. From the other side, we have to consider all the other aspects that are in the interest of other type of dimension. So we started with the landscape analysis in order to see which is the condition across different European countries. We have developed a questionnaire that will be sent to practicing neurologists, to neurological departments, to university hospitals. We will contact local opinion leaders, and then we will circulate this type of questionnaire in order to have back the opinion of all these very important components. And of course, we should, for all the aspects that we have just included in our analysis, we should really collect the point of view of all these stakeholders. And this questionnaire will be circulated at the end of the year or very early next year. So then the take-home message that we have in this context of a so important mission is that in a time of challenges that call for mission-oriented research, the future of healthcare sustainability is requiring a new multi-stakeholder and multidisciplinary managerial model of cooperation, and I think that I provided some evidence that this is the way we will operate. The European Charcot Foundation MS care unit, being a multi-stakeholder and multidisciplinary initiative, is really fundamental in order to try to disseminate, diffuse such a model and to apply this model, particularly in the early phase in Europe, but then even in a more extended way. And also the multi-act and the multi-act project, but the multi-act initiative represents a very appropriate opportunity from this point of view in order to be able to in the appropriate time to provide and to validate a tool that then can be really extensively applied to many other conditions. So I think that I finished, and I hope I was in the promised 10 minutes time. Thank you so much for your attention.
Thank you very much, Professor Comi, for your very interesting and clear presentation. It's all about the relevance of research and increase of the relevance, besides, of course, the rigor of research, in order to increase also the impact of the research for society and patients.